David Stuckler and myself, we're going to be talking about jobs in public health today. David's going to be giving you the lowdown on jobs in public health that might relate to research, academia, etc., etc. I'm going to field the other ones. We've been given a lot of questions up front. So I've gone through my YouTube channel, the comments on any particular video about jobs, try to extract the questions that I thought might be pertinent. I'm not going to put names against those questions because I don't know when those people phrase the questions if they necessarily want it to be, to be talked about publicly on a forum like this. But David, thanks for joining us. How are you doing today?
Hey, good to be back with you. I am sitting from lovely Copenhagen this time. That's quite funny. And I started this session because I've had a lot of students in my Facebook group, Fast Track, really interested in jobs right now, and this would be valuable for anybody who's going on the podcast.
Okay, and just so that you know, if you're watching from my channel and you don't know David, and you're interested in research in any shape or form, I don't know of anyone in the world that provides as much support and mentorship in the field of research and academia as David. If you're doing a PhD and you're not tapped in to his fast track grad, then you're doing something wrong. You've got to tap into that. It's the best resource I know of. Go team. While we're just doing a little bit of an advert, let me just say this. I'm just going to pop on the screen. If you join my channel as a member, my YouTube channel as a member, you get access to these additional resources. There's videos that you can access that the general public can't, all of in public health, and there's a jobs board where we have where we have current jobs that are advertised. Okay, anyway, enough about that. While you're watching, you're most welcome to put questions in. They'll pop up on the screen on the right. But we've got questions that are built in that I know people have already asked, and I'm going to pop those on the screen as we go along, and we'll try and deal with them one at a time. So one of the questions that gets asked quite a lot is what type of organizations can I apply to, right? And they say that everybody knows about the WHO, but people want to know about what other organizations, what other types of organizations are there out there. This is a relatively easy one. I mean, I'll talk about what there is in general, and David, you might want to talk about people that are into academia, what kind of organizations they might want to work for. But firstly, at a national level, all countries have got some kind of public health program. So there'll be a state-driven public health response in multiple different avenues. Okay, it could be health protection, so all the infectious disease stuff, the surveillance, et cetera, et cetera. It might be health promotion, which is helping people make healthy choices, et cetera, et cetera. There's health intelligence. So all countries will have something. Secondly, there's non-governmental organizations that work both within countries and at a global level. So at a global level, there's the Clinton Health Access Initiative, there's MSF, there's all the relief organizations. There's also funding organizations that you might be interested in. DFID, the Global Fund for AIDS, TB, and Malaria. There's the Gates Foundation. There's the UN agencies. So the WHO is the most obvious one, but then there's UNAIDS. There's UNITAID, there's UNICEF, there's even like the World Trade Organization, even though it's not a health-related UN agency, they have a lot of health-related work that they do, and they do employ people with a public health background. So the WTO is another good example. There's the World Bank and the IMF. They're not strictly speaking UN agencies, but they function as that sort of supranational organization. David, people looking for work in academia, let's say they've just finished a PhD or they want to work in academia without a PhD, what are their options?
Yeah, I mean, as you mapped out on the website, there's a bewildering array of options, and you need to move around, know where to look. With universities, unfortunately, centralized repositories where are listed. There are some weaknesses to the job market if you're going down an academic path and you don't pay attention to it. So depending on your field, in the U.S., there are offices and the job market are covered and connected to the you do need to know what that's happening. I've worked with several students who are applying, and we had to go to the website to several universities, exactly, to find out who's advertising. Sometimes you get knocks on the door. Are a few repositories. There's a lot of feedback coming through my audio. See if I can tweak that. I don't know why it's bleeding back.
Yeah, we're having some technical problems. We will. So David, you maybe log in, log out. Maybe that'll help. In the meantime, I'll just keep going, and if and when we can get David up and running technically again, that'll be great. Okay. Okay, so I'll just keep popping questions on the board, and I'll keep working on them. And as soon as we've got David back up and running, we'll lean more into the sort of academic and research orientated questions. So, a question I often get asked is, must I get experience in low and middle income countries in order to work in global health? And the answer to that is you don't have to get that kind of experience if it's something that's difficult for you to do. So you may have a family, you may be living, let's say, for example, I live in Dublin and I've got children and a wife and a home. For me, at this stage in my life, if I was interested in global health for the first time and I wanted, it would be very difficult for me to go and get that experience in a low and middle income country. So that doesn't preclude you from working in the global health space altogether. There's lots of people working in global health that haven't worked in low and middle income countries. That said, if you are in a position to get that kind of experience, if you're young and you're mobile and you're single and you've got the space and that you don't have kids and you can take some time and go and get that experience in a low and middle income country. There is nothing like that experience to give you the insights into some of the health systems problems, the health systems challenges, the on the ground implementation issues that emerge in global health. There's nothing like that experience, that kind of insight. And that sort of insight will certainly inform a lot of the decisions that you make and a lot of the kinds of work that you do later on in your career. So if you can get that experience, do. If you can't get that experience, not to worry. There's lots of things you can do. There's lots of roles you can have that don't require it. So the short answer is you don't have to. If you can get it, I would say go for it. And I've worked in low and middle income countries, and I absolutely loved it. Some of the best times of my life have been in those environments. Okay, I got this recently, but it applies to more than just engineers. So a person who's an engineer said to me, I'm an engineer. Are there roles for someone like me in global health? And obviously the short answer is yes, but it might not be obvious to a person working in, if you're an engineer, you might not see where it is that an engineer would add value. The truth of the matter is, a lot of public health problems are simply practical problems that need to be solved. There might be engineering problems. Fresh water, getting fresh water to people in a village. That if you get that right, you solve a whole lot of public health problems. It's an engineering problem, right? It solves a public health problem, but the solution lies in a sort of a feat of engineering. I'm of the view that whatever discipline you come from, you bring a skill set that can be applied in the context of public health in some way or another. Let's say you're from banking and investment. Wow, there's loads of things happening with innovative financing in public health. Take Unitaid, for example. Unitaid's a very interesting example of an innovatively funded agency that gets money from the airlines, for example. Knowledge, if you're good with numbers, there's all sorts of things you can be doing to help with demand forecasting and quantification of drugs to get them into poor countries, for example. So if you want to work in the space of access to medicines, you need to get involved with procurement and supply chain of medicines. And if you have got a good facility with numbers, that would be useful. So there are job opportunities in public health that I think can take advantage of people from a real disparate and a real wide range of skills and backgrounds. So whatever you're doing, if you've got an interest in global public health or in public health, believe me, we can use you. Don't shy away, lean in. This is the right place to be. I see David's coming back in, and I'm just gonna pop him back on, and we'll see if the sound is improved. David, welcome back. How's the sound?
Fingers crossed this is not going to echo.
Well, you're sounding good to me. If people in the comments can just just send a comment in saying that David is sounding smooth as chocolate, and then we'll just keep going.
I can't. It's bleeding back in. I just jumped on Zoom room. I'm not getting echoed back in. But I'm hearing it come through. So I got some audience to do, Greg. Echo's still there. The thing is, it's probably for me to step out and bring back through. I'll follow along from the comments.
Okay. The other thing you could do is you could, maybe if you could respond in writing to questions that pop up on the screen or something like that. Okay, thanks, David. Sorry for people watching. Technical stuff happens. We do our best, and we just got to roll with it. So that anyway. So okay, we'll keep rolling along. And David will pop into the comments some answers to these sorts of things, and I'll try and answer some of the sort of more academic questions myself, even though David would be the right person to give an answer to this sort of thing. Right. A person says, I have a PhD, but I don't want a career in academia. What else can I do? Please help. Now, if you've done a PhD, obviously, most people do a PhD with a view to an academic career or a research-orientated career. You might find that you don't want to work in an academic environment. You don't want to work in a university. That's not the end of the world. The skill set that you have is applicable in multiple areas of public health, right? So public health, everything we do is meant to be evidence-based, and a person that has got a skill set in terms of understanding research and maybe even able to do research, pulling together data, making sense of the evidence, that's going to be a skill set that you have, is absolutely invaluable. And you would definitely find that you're in demand in multiple, at the WHO and at multiple organizations that need that evidence base for the advice and the guidance that they give. Added to that, let's say you've done a PhD where you've developed a real deep set of skills and knowledge and understanding in a very technical area. You suddenly become a technical expert in that space, and you can become a policy advisor, et cetera, et cetera. So if you've done a PhD and you feel that you don't really want to work in academia, not a problem. Public health still loves you. Global health still loves you. Hang around. We'll definitely find things for you to do. Okay, next question. I get this quite a lot. People say, I see you did an MBA, Dr. Martin, and do we all need to do the same thing? No, you don't. I did an MBA because of the kind of work that I enjoy in the context of public health. So I like a lot of the operational stuff, getting things done, moving things forwards from just a practical point of view. That's something that I enjoy. Not everybody is interested in that side of public health. So, not everybody has to do a PhD. An MBA. If you did an MBA, absolutely. Like anybody that asks me, should they do it? And if they've got the time and the resources and they've got the space to do it, then I say, yes, go ahead, do it. I find I use the skills and the knowledge that I gleaned in that MBA all of the time. So I'm glad I did it, but I definitely don't feel as if everybody needs to do it. Okay, we're gonna have another bash getting David in here. David,
how
you
you
doing?
try one
more time? Okay, well, you sound fine to me, but if anybody in the audience can just say whether or not David sounds fine on that side, or you still hearing echo?
bleeding back in through the speaker. So yeah, I'll be in the comments. We tried.
Okay, we did our best. We did our best. Thank you for logging in there, David. And then I see, and I'm going to try and get to some of the comments that people are making in the discussion as well. So keep the comments coming, and I'll go through the questions that I've got sort of preloaded as well. Next question: I'm an MPH. Is an MPH sufficient to work in public health, or do I need to do an MD or a PhD? There's a very short answer to this. You absolutely do not need to do an MD or a PhD. By all means, if you are a medical doctor and then you go and you do an MPH, that's great. Your clinical skills, your clinical knowledge and insight will be useful. But if you're interested in public health and you've done an MPH, to then go and you want to work in public health, to then go to become a medical doctor as well, I think is a huge amount of time and effort that isn't necessarily going to pay dividends in a way that's commensurate with that time and effort necessarily. If you've done an MPH, there's all sorts of ways you can get involved with public health without being a medical doctor. If you've done it the other way around, thumbs up. Medical doctors in public health are tremendously useful, and they add a lot of value. Same with the PhD. You don't need a PhD to work in public health. If you've done a PhD, that's great. That's very useful. If you want to work in public health in a way that includes research and data and being a very technical policy expert in a particular area, then doing a PhD might be something you want to do. Nothing wrong with that. But don't feel as if without those sort of additional degrees you won't have a career. That's not the case. I worked at the WHO, and most people that I worked with were not doctors or PhD graduates. So that's, I don't have the statistics, but I can tell you that in my day-to-day life and work at the World Health Organization, there were very few people that were medical doctors, and there were very few people that had PhDs. Most people came with a different skill set. Some people had no MBA, sort of MPH at all. And they just came with a skill set. So, but an MPH is generally considered sort of entry level, something that you do need as a requirement. Okay, next question. Is an online MPH just as good as an in-person MPH? Absolutely. You do, and look, let me just say this about doing online MPHs. Very often you need to do an online MPH. Hi, David's there in the comments. Hi, David. Very often people do an online MPH because for practical reasons, doing one in person just isn't possible, right? They've got a day job, they're doing it in their part-time or in the evenings, and going and doing it full-time isn't possible. And for those people, if that's you and you're doing an online MPH, you will get out of the MPH what you put in, right? So like just work hard, pay attention, take an interest, and you're going to be fine. If you're able to do an in-person MPH, it's one of the most fun years of your life, so absolutely, so do it if you can. Not everybody can. The big advantage of doing an in-person MPH is the relationships that you build, the people that you meet, the friendships that you make, because those friendships turn into friendships for life, but not just friendships, they also turn into your colleagues and your professional network. So an in-person MPH has that additional advantage. So yeah, I would say, do whatever is most practicable for you. Now, I know David is in the comments, so I'm going to put up a sort of PhD related question, and maybe David can respond in writing, and I'll try and read your comments back, David. So we are improvising here, people. We're improvising. My PhD is on a very specific topic, but I want to work outside of that area. Is that possible, or do I need to start again? So I'm guessing the answer to that question, but I'm going to see if David can come in with some wisdom here. I'm guessing the answer to the question is if you don't start again. Like if you've done a PhD in a particular area, and this relates back to something I was saying a little bit earlier, you have got a lot of transferable skills with respect to understanding research and understanding data, understanding the scientific method, and you will probably have some deep technical knowledge in an area which you may or may not want to apply in your career. So I'm going to see if a comment comes up from David that responds to this, and he might be typing something as we speak. And just so that people know, I've never done a PhD, and I've got deep respect for anybody that has, because I've seen so many people do PhDs, and I know that it takes a lot of time and effort, but I also know that people that do PhDs do come out on the other side with a lot of skills and a lot of insight, and those skills are transferable skills. So David may come back with a comment to that question in a second. Okay, right. So David Stuckler, Professor David Stuckler says, for many students, you have a lot of technical expertise and many translatable skills, and that's exactly what I'm saying. I absolutely agree with that. Writing efficiency, good point. Presentations, absolutely. So I recommend many of my students build a bridge, and transition often through internships or co-authoring or collaboration with a target institution. Okay, great advice from David. And if you couldn't sort of follow me stumbling through, David's comments are on the screen there. You can read them for yourselves as well. Right, next question. The WHO usually want 5 years of experience in order to be eligible to apply. So the WHO jobs usually, there's the P1, P2, P3. I think it goes up to P5, and then it's anyway. The point is, the sort of entry level jobs, usually even at an entry level, to get a job at the WHO, as well as having an MPH, there'd be a requirement that you have at least 5 years of working experience, and people want to know, what does that mean? Having worked at the WHO, I'll say this: when they look, just please understand that when you apply for a job at the WHO, your application will be one of many. It's on a big, huge pile of applications. Now, the person going through that pile is not the hiring manager, right? So you may have written an outstanding cover letter and explained in detail why you are, without question, the best candidate for this job. You're a superhero and you're going to knock it out the park, and they should love you. That cover letter is not being read at this stage, in the first instance. So this is what's going to happen. Your CV will be looked at and scrutinized very, very carefully. And it's not really your CV. You fill in an online application within which you delineate your work experience. That will be scrutinized by the Human Resource Department. Their number one objective in the first instance is to whittle this number. There's hundreds and maybe thousands of applications down into a manageable number. In other words, anybody who doesn't meet the criteria that have been been like outlined in the terms of reference of the job. If you don't meet those criteria completely, 100%, your name's off the list. They're not reading the cover letter and making an exception because you're a superhero of some description. You've got to meet the criteria 100%. And the criteria are usually asking for 5 years of experience in the area of work that you're applying. In other words, having worked for 5 years in general, even if that 5 years in general was in public health, but the work that you did for those 5 years didn't overlap specifically with the kind of work that is being asked for in the terms of reference for that particular job, that work experience won't apply, right? You've got to have work experience that overlaps with what it is that they're asking for. Now, sometimes you can use your imagination and describe the work that you've done, and you might be able to identify aspects of the work that you did that overlap with the terms of reference, and maybe there'll be a little bit of wiggle room there. I don't know, but just having worked in public health for 5 years in general doesn't necessarily make you eligible for the jobs that are being advertised. It's got to overlap. Okay. Next question, and this might be one for David in the comments. Can I do a PhD while I work? How hard is that really? So while I wait to see what comments might pop up from David on this one, I will say the short answer is it's certainly possible, and there are people that do part-time PhDs. I can imagine that that's a very difficult thing to do. That you need a little bit of breathing space to do that. Doing a full-time PhD, it strikes me as quite a difficult thing to do. Doing a part-time PhD must be extremely hard if you've got a day job. Some people have got kids. To squeeze it into the wee night hours can't be easy at all. Having said that, people do it, so it's certainly possible. I know increasingly there are universities that offer a PhD by publication. In other words, you can, if part of your day job is allowing you to publish a number of papers in a certain direction, and in advance of those publications, you've registered as a PhD candidate, in the context of one of these programs that allow for a PhD by publication, then the publications that you then generate, and they could be generated as part of your day job, so this makes it a lot easier. And then I think at the end of that, you need to probably write something that ties it together, and you probably still need to defend that PhD. And going that route would allow you to get a PhD in a part-time way that's probably not too onerous. Okay, now I see David's coming back, and we may have him. David, talk to us. What's the lowdown? What's the word on the street? Can we hear you?
Well, I'm trying with AirPods now.
And?
No, I think there's still an echo. Can you try just to mute for 1 second? Mute your side 1 second, Greg? Let's see now if that works. So that, I think, has that took the echo away on my side. I don't know if anybody in the stream can hear. Yeah, echo's gone, Greg, when you've muted. I don't know if you can hear me. Take off the mute for a second.
Okay, well, why don't we talk one at a time then? So when you're talking, I'll go into mute. So the problem is me, people, just for the record. The problem has always been me.
Okay, yeah, because it's a really bad echo if it bleeds back in. People are saying now the sound's perfect. Okay, Greg, you were talking for a second. Let me just go in and talk about PhD by publication, because I'm really, really pleased you mentioned that, because that is what I would do today if I could do it all over again. And the reason it's so efficient is instead of playing around in the kiddie pool and learning lots of theory, you're diving straight in and doing research in your field. You learn by doing. And those papers, they're like money in the bank when you go in the job market. You can use those papers to help you get that internship, to help you connect with people in your field, and really make sure you love what you do. I just think it's the most efficient way to learn, the most efficient way to get jobs. It's the most affordable, and it's the fastest. So if any of you are interested in that, let me know. I've got some great trainings, an overview that's going to tell you everything you need to know if you want to explore if that path is right for you, and it's really great for mid-career folks. Okay, Greg, back to you.
Thanks very much, David. So I've just popped on one of the questions that people have been asking, that in the chat. And this question from Mustafa: how important is taking data science courses after obtaining an MPH or an MSc in epidemiology for a career in public health? Look, I think it depends largely on what kind of work you want to do. right? There's a lot of people that work in the public health space who don't work with data and quantitative work at all, right? They might work with health promotion. They might be trying to stop people from smoking. They might even be involved with sort of research and data, but it might be anthropological or qualitative research. So not all of public health is quantitative work, is working with data, is working necessarily with epidemiology. I do think there's a huge value in understanding particularly epidemiology, not necessarily statistics. I know statistics scare people. I love stats, but not everybody loves stats, right? And it scares some people. Don't worry about that. You have to do stats in your MPH if you're going to do an MPH, but some people sort of grit their teeth and get through it. Look, understanding epidemiology is important because epidemiology underpins everything in public health. Epidemiology is the science, is the study of the distribution geographically, temporally, and demographically of disease and states of health, and the causes of disease and the relationship between the causes in those states. Understanding that is the basis for everything we do in public health. In fact, public health, in my mind, is the application of epidemiology. So epidemiology is sort of the academic discipline. And when we ask ourselves, well, what do we do about that? That's public health, right? So understanding epi is important, and being very proficient at data is great if you're that way inclined. If you're not that way inclined, don't worry. There's lots of things you can do in public health. The fact that Mustafa's asking the question about data science suggests to me that he might want to do that. And if you're inclined in that direction, then go for it. I love data. There's nothing that makes me happier than being locked in a room with a whole lot of data to analyze. I'm just going to put myself on mute and ask David if he wants to jump in with anything to add there. Can't hear you at all, David.
I muted myself to avoid blading to the stream. I've been taking an even stronger view, Greg. I think the data is indispensable in this day and age. That you will need in any position to not feel lost when you're sitting at the table and people jump into the data. You're going to need a basic level of conceptual literacy to make sense out of it. I mean, even you can see on COVID, people now know what reproductive number is and understand positivity rates and other parameters they never thought about. But just to follow the conversation, you need that basic literacy. So very few people I work with are trying to break new ground in stats. And so a lot of the trainings, and I know you have some good ones too, our trainings really take the numb out of numbers. And really, I think our students that we work with learn really well when they can pick up these tools from the kit and start applying them to things that they care about. And when you proceed in that way, again, learning by doing, suddenly you find you've mastered a lot of skills that sound fantastic on your CV, and takes the fear right out of it. So I strongly encourage you to crack on, maybe pick up one of Greg's courses or pick up some of my free courses. You're going to get a ton of value out of it, and I think you'd be surprised at how fast you can break ground. Yeah, now you're on mute, Greg.
Thanks, David. I'm just going to throw another question onto the slide there, and just to round off on what David was just saying, added to the value of being sort of comfortable with some of the quantitative stuff that you're going to come across in public health, being comfortable with evidence and research on the scientific method, even if it's not part of your day job, but understanding how science works and being able to engage with evidence, I think is a skill set that you will use all of the time, and we should be evidence-based practitioners. Okay, now question: I have an application to make. One of the requirements to be considered that I must have had a job related to public health. I'm an acute care nurse. How can I explain that I qualify? Please help. Okay, so this is where you might need, so your day job as an acute care nurse wouldn't necessarily explicitly be working in the context of public health. So it would be difficult to make the argument that you've necessarily got public health experience per se, to be honest, because public health is about working on a health issue at a population level, and most critical care is really dealing with individual patients, and that's sort of the distinction between public health and regular clinical medicine. Having said that, I think anybody that's involved with something like nursing, any kind of clinical work, right, and you're applying for a public health job, you can make the argument that because of your clinical experience, you've developed insights into the relationship between different demographics and health, and you've worked with vulnerable people and hard to reach populations, and you've understood the relationship between some of their social economic backgrounds and the diseases that they have. So you can point to the fact that you've got this coal face experience working closely with real patients, and you've understood a lot of the context in which their disease may or may not have arisen, or the states of health. So I think you can point to insights that you've gleaned from your experience, even though your experience wasn't necessarily public health work per se. I hope that helps. And I think that's the kind of thing that you can build into your cover letter, and you can really explain how it is that and why it is that you're interested in this public health job. You're probably interested in public health because of the work you've done working as a critical care nurse, and you want to hammer that home. Now, if the job requires of you to have had public health experience, then your clinical work probably won't count. But there are things you can do. And let me just sidetrack for a quick second here. People often ask me, how do I get the experience that I need to get the job? Because I don't have the job. So if I can't get the experience, I can't get the job. If I don't have the job, I can't get the experience. There are things that you can do outside of the context of formal employment that can count toward having done something, right? So for example, in my spare time, I started a little journal called Globalization and Health. It's not part of formal employment. It's something I do on the side, but I bring that up when I apply for a job, and I stick it on my CV, and I put it into the cover letters like that. I've been working on this journal, and it's had a public health impact, and it's something that I did on the side. The YouTube channel that I do, not part of my day job, but I bring it up in job interviews, and I talk about the fact that this is something that I've done, and this is the impact of it. And so there are things that you can do. I remember once, when I was at the WHO, we were hiring, and I think I've talked about this on this channel before, where we had to choose between two people that were both equally strong candidates. And one of them, in her spare time, had started a blog in the area that we were employing. Okay. Shout out to Ali Grant. And that was the deciding factor. Here's somebody that had gone the extra mile, had spent her own time and energy working on something, and clocked up some experience outside of formal employment. So don't ever discount that. David, do you have anything to add on this particular question?
I really would just echo you here, Greg. I think as a nurse, you probably have a real reason why you want to make this transition to public health. I worked with a doctor who recently made a transition into public health, and is actually going to start an MPH. And part of the argument for making that transition was got really frustrated on the wards of not being able to treat the environments that patients were coming and bringing problems that he was continuously trying to treat in the hospital, but not really getting to the root causes. So I think that narrative can be compelling. And I do want to make a point about eligibility. So it's good you're paying close attention to those eligibility requirements, because I do see a lot of people apply for jobs and get depressed when they're just not a good fit, or they don't meet the eligibility requirements to those jobs. So in your case, I wouldn't let it deter you. But for others, and I don't know, you may have a different take on this, Greg. If you're not a good fit, if you don't meet the eligibility requirements, should you apply? I usually discourage my students from applying if it's not a fit.
I would agree with that. Thanks very much, David. Now, I don't know if this super chat came to your channel or to mine, David, because we both logged onto this, but I've never received a super chat before. So, Black Passport Fit, thanks very much. I really appreciate it, or David really appreciates it. One of the two of us really appreciate the super chat, because actually he's made a donation to support one of our two channels of $9.99. So that's very, very kind of you. First time it's ever happened. So thumbs up, really appreciate it. I'm delighted. Okay, so obviously we'll spend some time reading your comment and trying to address the question that you asked. I'm currently in the middle of my MPH in global health, and I work as a PE teacher in an international school in China. I don't know where and when I should start looking for a career in public health. I think it's often in the middle of an MPH. It's very difficult to see where it is that this is a stepping stone to, right? So you're studying and often you're studying it's an MPH in global health, so you'll be studying a very broad range of subject matter. It'll be the basics, it'll be stats and health policy and health economics and all of those sciences. And at the end of that, you'll be saying, like, well, what do I do with all of this? In a global health MPH, you may well be leaning into some more specific subject matter. You might be doing a module on maternal and child health, for example, or access to medicines, or some of these issues that are important in low and middle income countries. And what I would do is try and use that opportunity to see if you can identify a particular area that you really want to lean into, because making career choices becomes much easier once you've got a real sense of what it is that you'd like to do. Now, I understand that that's not always easy. Okay, I'm turning 50 next year, and I still haven't really figured out what I want to do with my life when I grow up. So it's not easy to do, but during your MPH, you're getting exposed to so many different subjects and so many different people and experts and people that you can talk to. So you can talk to your professors and lecturers. And if you can hunker down on a particular area, if you can find yourself interested in a particular domain of public health, that will go a long way to helping you kind of then focus on it narrows down the number of organizations you might want to look at and where you're going to apply and what kind. So that's a useful thing to do. It's not always possible. David, any advice from yourself on this particular issue?
Let me come on to that, because I think it's a really great question. And Black Passport Fit, I'm really glad you asked it. I think you have two great opportunities to take advantage of in your MPH. And one is your internship, and the other is probably going to be your master's thesis, capstone, or however it's structured. And both of those, I think Greg's advice is golden. Lean in and take advantage of, connect with your professors. See if there's an area you're passionate about, find the right professor, volunteer to work with them for free, and you'll get a lot of mileage out of that, because my first internships that I got with the WHO directly came from me having started a productive collaboration with one of the professors in my MPH. And I remember when I started the internship at WHO, one of the first things I had to do was send out rejection letters to everybody else who didn't get that internship. And I got it all booked, and it wasn't really fair. But this is how you can engineer your own unfair advantage. And you're paying for this MPH. You're investing to make the most out of that investment. There is a big untapped resource. I would highly, highly encourage you to use them, because they can be the keys to future jobs.
Thanks very much, David. Okay, another great question here. I have a great interest in infectious disease. My clinical background is as a dentist. Is it sensible to learn MPH in ID? I couldn't find a dentist qualified in ID. That's why I'm asking. You know what? Infectious disease is such an exciting and relevant and current aspect of public health. Doing an MPH that's got a special stream or particular a focus on infectious disease, given that you've already got a clinical background, that clinical background would be a huge foot up in that direction. I'd absolutely, if you've got the opportunity, if you found an MPH program with that kind of stream, an ID stream, and you're able to, then the short answer is yes, I would do that. Any thoughts on that one, David?
Yeah, 100%. Great, fantastic idea. I mean, especially on a lot of infectious diseases, there are kind of oral health manifestations that also need to be treated, and that we're learning a lot more of some dentists working in the space of the systemic effects of oral health. So I think it's a really exciting space to be in.
David, I think we'll probably both be able to lean into this one a little bit. The difference between a PhD and a DRPH. I mean, my understanding, a PhD is very academic. You really leaning into research skills. A DRPH, I haven't done one, but I know people that have. And the impression that I have is that there is a very practical component to the DRPH that's built into the program. In other words, I think in a DRPH, you usually attach yourself to an organization of some description for a 6-month period of time. And then off the back of the work with that organization, you develop some sort of research question, and you build your research around a practical problem or issue that you identified in the context of that work. So a DRPH definitely is is a qualification that tees you up both with a very strong academic qualification, but it tees you up for a career in public health that might be outside of academia. David, any thoughts?
Yep, definitely. There's a more applied focus and bent on the DRPH, and that's built into the structures of the programs. I would definitely check it out. I mean, one that really brings it into clear distinction as a student grappling, should I do DRPH, PhD? Ultimately went the DRPH route. But take a look at Harvard's program, for example, and you will see very clear differences where the PhD, there's a heavy pressure to publish and do cutting edge academic research, where the practical component is valued more heavily. You're not going to have that same research pressure. I see maybe taking Harvard's PhD again as an example, maybe 1 in 3 going down the PhD track. I've seen one state go down an academic path, where the DRPH, very, very few, if any at all, are thinking to go down an academic path. So you have to really look at the fit. And I think the best way to do that is to, again, talk to students in these programs, and again, talk to faculty. Especially for the PhD, you need a close mentorship relationship with a faculty member. And often those faculty members play a critical, decisive role in who gets admitted. DRPH admissions decisions are a little bit different because it's less of that same close one-to-one relationship, and it's more of a kind of a structured program that you're working through. So I hope that helps to clarify. But the best way to really demystify this is do your homework and look very carefully at both.
Thanks very much, David. Okay, is there a way for an MD, medical doctor, to combine clinical and public health work? Thank you. Yes, absolutely. So I'm a medical doctor, for example, and I've made public health the sort of almost like the discipline within which I've specialized. In fact, I spent 4 years as a specialist registrar specializing in public health. So we here in Ireland and in many countries would think of public health as one of the clinical disciplines that you can specialize in. Now, I also know many people who have a clinical career in a particular direction. Like, for example, I've got a good friend who's a pediatrician, and he wants to carry on with that career in pediatrics. He still wants to have that clinical contact. He still wants to see kids in a clinical context, but he's interested in public health. There's a number of ways that people like that can get involved. Firstly, some people develop a little bit of a sort of a hybrid career where they work clinically for some of their time, and they carve out specific chunks of time during which they might go out and do, they might actually do relief work in Africa, or that sort of thing with MSF or something like that, or they might get involved with chunks of time with the WHO, with other organizations in terms of developing policies and guidelines, et cetera, et cetera. Or it might be a matter of, like, you've got a day job, your day job is working as a pediatrician or as a clinician in some particular area, and that as part of your job, you find ways of involving yourself with public health issues of the country that you're living in, right? There might be guideline development, there might be there's all sorts of things you can do, and you need to reach out to your colleagues in your country and say, I'm a pediatrician, but I'm interested and I want to get involved and I want to help. And believe me, they will be delighted, and they will want to work with you to, let's take the example of pediatrics. They'll want to work with you to understand the burden of disease in pediatrics, understand what it is that's causing disease. What can we do to try and mitigate that? What do we need to put in place to improve access to healthcare? Where do the services need to be? I mean, there's so many public health issues that revolve around kids that having a pediatrician as part of that conversation would be useful. And the same thing applies to any other discipline. You might be a obstetrician. Well, maternal and child health. Like, we need to, public health doctors and public health professionals need to be working very closely with obstetricians to understand how it is that we can provide a better service to that part of the population. So lots of opportunities for medical doctors to be involved with public health. Any thoughts on that one, David?
Yeah, I think sometimes it's not that well structured into what you do day in, day out as an MD. You do have to take some initiative and perhaps look for it, and also potentially at the beginning be willing to just work for free or donate your time to get plugged in. But that's what I've seen, especially with U.S. doctors who are an MD track, that they do sometimes find there's not just this open door that's going to take them down there where they can do half a day MD, half a day public health. You might have to get a little bit creative and be flexible to make it happen. But it's very rewarding if you do. So it's not your ticket to a boring life, that is for sure.
Okay, here's an interesting question. I have both a DVM, and I'm not quite sure what a DVM is, to be honest, and I've just popped it into the chat if that person can just tell us what a DVM is, some kind of qualification, and an MPH degree, and I'm currently working on getting my MBA. So whoever this is definitely clocking up a great set of qualifications. I've got a strong interest in the One Health field. Good, thumbs up, that's very important. What is your advice? A doctor of veterinary medicine. Actually, I should have thought that, right, with the interest in One Health, absolutely. So you're a vet, you've got an MPH, you're doing an MBA. Look, you are not going to struggle to find a job, by the way. Who's this? Mutunde. Look, you are going to be in demand. One Health is without question an emerging issue that everybody's going to want to find people like you that have got expertise. You're going to understand the public health side of it because you've got the MPH. You're certainly going to understand, the nature of the spread of disease amongst animals and the connection with people, and then you're doing the MBA, which is you're just going to be a super duper useful person. So, what is your advice on the job search? I mean, I'd like to believe that people will be knocking on your door and clamoring for you, but I know that doesn't always happen. I would look. I'd like to say to reach out to me separately because I could put you in touch with like 20 people that are interested in this One Health area, but definitely network in the sort of One Health community, and they're not difficult to find. It's not a huge community because it's a relatively new kind of discipline, not that new, but they're not that difficult to find. You go onto LinkedIn, you can hunt around at the WHO, find the people that are interested in One Health that are working in that area. Those people will immediately see the value of a person like you with your particular set of background and education, and I would say they'll snap you up. You're not going to struggle to find a job, believe me. If you're in Ireland, phone me, because you're a tremendously useful resource. Any thoughts on that one, David?
Yeah. Just going to echo that, Greg. And I wouldn't be shy about networking, going onto LinkedIn, search One Health, find out who's who, and reach out, contact them. You might need a professional account in LinkedIn to be able to do that. It's worth the small expenditure if it opens up your network and potentially helps you land that dream job opportunity. So yeah, I would not be shy about aggressively networking in that way, especially with your qualifications.
Sorry, I was yabbering away there with myself on mute. I'm going to make this the last question for today, just because we're going to run out of time. And what I'm going to say, David, if you're happy to, let's do another one of these, because I think that there's so many things we can talk about with respect to jobs and careers in public health. And I deliberately called this Public Health Jobs Q&A, and you'll see in the title, I've said number one, and that's because my intention is to do more than one of these. I think, especially at this time of the year, there's an interest. So if you're happy, David, give us a thumbs up. We'll do another one of these. Okay, so there's a thumb. Good man. Now, I just wanted to put this question up because how reputable is the London School of Hygiene and Tropical Medicine? That's where I went. It's a great school. Had a great time. Absolutely loved it there. But there's a lot of good schools out there, so don't feel any pressure to go there. If it's not easy for everybody. London's not a cheap city to live in. David, any recommendations from you about where a person should or shouldn't study public health?
Just muting here, Greg, so we don't bleed back. The nutritionist. I think I'm lagging a little bit, Greg. So let me step back. I just want to in the comments.
We can jump into this question as well. We've got a couple of minutes. I'm a nutritionist with an MPH. My interest in is obesity and metabolic health. What specific skills will I require to enter the job market? Your channel is very helpful. Thank you. I think you've got the MPH. You're a nutritionalist. I think what you need, it's very difficult because it's not a field that I work in particular. I'm not in that space in nutrition. But a good place to go if you want to understand the kinds of experience, the kinds of skill sets that are needed is look at the terms of reference of jobs that are being advertised. And within that, there will be a clear description of what it is that they're looking for, and then find ways of clocking up those particular skills. And sometimes you need to do that outside of the context of formal employment. You might need to volunteer. You might need to work as an intern. You might need to do something of your own on the side in the evenings. But you need to find a way of clocking up the experience that they're looking for. But I'm not. I haven't worked in that particular space. I would say it's tremendously important, and I wish you well. But I don't have a great answer to that question, to be honest. Any thoughts, David?
Yeah, I think is find somebody who can role model. Is there somebody who helps you with that? So is off space and about reaching out, and it's really important in this conversation to have a mentor, somebody for advice, for support, somebody in your corner. I mean, I've had many mentors along the way in my career. Think hard about what mentor do you have right now, who you turn to, and touch. And we've got a great video to help you find the right mentor. So yeah, that's Greg. I'm a little worried that we don't have an echo.
Okay, I think we're going to probably end it there. We've been going for an hour. We're definitely going to do more of these. This was number 1. We'll do number 2, 3, and 4 some other time. I just want to say thanks to everybody for logging in. Thanks for your questions. It's been a lot of fun. I always learn, whenever I have any session that includes David. Sorry, everybody, about the technical problems that we had with the sound. These things happen. You just got to roll with it. So from myself, thanks, everybody. Don't do drugs. Always do your best. Don't ever change. And from David,